name is Andrea Green, ADN student at Wilson State College, and today I'm going to be demonstrating administering medications through an IV push as well as an IV, mixing an IV solution with medication and administering that as well. So first I'm going to start with hand hygiene and entering my med room. And I see I have some healthcare provider orders here, as well I have my MAR pulled up. And first I'm going to verify I have the same patient. So I have Shirley Coast, date of birth, 4/3/87. And that matches, and both have an allergy of codeine, so I'm going to verify that with her. And on my orders, I have an order for 0.9 normal saline, 250 milliliters with 20 MEQ potassium chloride, and that also matches with my MAR. I've already done my dimensional analysis, so I know that I need to draw up 10 milliliters in total of potassium chloride to put into my IV bag. So then I also have morphine sulfate, 4 milligrams, IV push, every 2 hours, pure in pain. So I was just in Shirley's room, and she said her pain was a 7 out of 10, so that is warranted to administer this medication. And I've done my dimensional analysis, which I know that I need 0.4 milliliters of morphine reconstituted with 1 milliliter of solution. And then as well for the potassium, our potassium level is 3.1, so I know that that is also warranted to administer at this time. So I'm going to prepare my medications after I've checked that everything matches. So perform hand hygiene, and I'm going to don some gloves. So the first medication I'm going to prepare is the morphine. So I'm going to grab my morphine from the Pyxis. I'm going to perform my first medication check. So I have morphine sulfate, 10 milligrams per milliliter. I know I need 4 milligrams, so that's 0.4 milliliters. And then I'm also going to make sure that matches my provider orders just for a second check. So I know that that matches, so that was my first medication check. So I'm going to clean the stopper. Inner to outer in a circular motion, 10 to 15 seconds. Okay, and while I let that dry, I'm going to prepare my needle. Okay, and then I know that this is clean. I'm just going to do my second medication check quickly. Morphine sulfate. That matches, and I know I need 0.4 milliliters of morphine. So I'm going to drop 0.4 milliliters of air. And then I know this stopper is clean, and I'm going to inject it into my morphine. Then I'm going to invert the vial, and I am going to draw up 0.4 milliliters of morphine, while also removing any air bubbles. So I'm going to remove this. I'm just going to ensure that there are no air bubbles. So get the air bubbles out, make sure I'm at 0.4 milliliters. I'm going to have my second nurse verify that I have 0.4 milliliters for the patient that I'm administering to in the level of pain, and that it was administered over 2 hours ago, so this is warranted. So then once that is verified, I am going to mix it with, or reconstitute it, which I have an unopened saline push I can reconstitute with, so there's no need to clean the stopper, the top. So, and then I'm just going to withdraw to 1.4 because I need 1 milliliter, should make it 1.4. I see I have an air bubble in there, so I'm going to ensure to get that out. Okay. And then I'm just going to get my air bubble out. Okay, so then I have 1.4 milliliters of medication, so I'm going to recap. I have my medication label, which I would write on with all the information I need, and make sure that matches my vial and my orders. So once I know that that matches, I'm going to put that onto my needle, and then this is ready to take into the patient's room. So next I have my sodium chloride. So I have this from the Pyxis. I have potassium chloride. Potassium chloride 20 MEQs. It's 2 MEQs per milliliter, so I know I need to get 10 milliliters. And this needs to go into a 250 milliliter IV solution of sodium chloride, and I have that. Bag's not expired, there's no holes, this would have been unopened. The color is good. So I'm going to clean the stopper of my potassium chloride. Inner to outer. 10 to 15 seconds, and then while that dries, I'm going to prepare my syringe, or my needle. So I have a 10 milliliter syringe. Okay, so now that I have that ready, and I know the stopper's clean, I'm going to do my second med check, 20 MEQ, potassium chloride, 20 MEQ, potassium chloride, and I'm going to be withdrawing 10 milliliters of this. So I need to draw back 10 milliliters of air. Okay. I know my stopper's clean because I cleaned it, and I'm going to inject the air. And then I can invert. And I can withdraw 10 milliliters of potassium chloride. Making sure I get any air bubbles out. Okay. Make sure I get the air bubbles out, and then I'm going to recap. So now I have my IV bag. I've already checked that it's within the date, that it's the solution is good, and I have a 250 milliliter bag of sodium chloride, and I'm going to clean this stopper here. 10 to 15 seconds, circular motion. And then once it is dry, I am going to insert my 10 milliliters of potassium chloride. Careful not to poke through the bag. Okay. And then I'm going to recap my needle, and that can go into the sharps. Okay, and then I am just going to mix my solution by turning it back and forth. And I have a label here, potassium chloride. I'm going to make sure that matches with my bottle as well as my provider order, or my MAR. And that matches, so I can stick this on here. I'm going to stick it on the back so it doesn't cover any pertinent information. As well, I have a client sticker as well, so make sure that matches. Shirley Coast, date of birth 4/3 of 87, and stick that on. And I'm also going to write on there my initials, the time I initiated it, and the date. So now I have my 2 medications ready to go into the patient's room. So I'm just going to bring them over. As well, I will need my vials. Okay. Okay, so I'm going to knock, provide privacy, introduce myself, and have the patient confirm their name and date of birth. So she's telling me it's Shirley Coast, 4/3 of 1987. I would have performed hand hygiene, changed gloves. And Shirley, do you have any allergies? Codeine, okay, and that does match my records here. We're not administering any codeine today. So Shirley, for you today, I have some morphine because you said your pain was a 7 out of 10, so that's going to ease your pain. And as well, I have some potassium chloride for you because your potassium levels are a little bit low. So that's going to be through your IV. So first, I am going to clean the stopper. As well, at the same time, I'm assessing the IV side. I don't see any redness, swelling, any signs of infection. Into 15 seconds, and that's clean. So first, I want to make sure that the IV is patent. So make sure it's unlocked. I'm just going to do a saline push. So first, I'm going to aspirate, make sure I see blood return, and I do. So that means that we're in the vein. And then I'm going to push. Okay, I don't see any signs of infiltration like swelling, coolness. Are you having any pain, Shirley? No? Okay, perfect. So that means that's patent. And now I can administer my morphine. So I take the needle off, put it in the sharps container. I've just flushed and just cleaned the saline lock, so that is okay. I'm going to do my third medication check before I administer. So I have morphine sulfate, and I'm administering 1.4 milliliters in total, 0.4 milliliters of morphine, which I verified with the nurse. So in the clinical setting, we would push this over 2 minutes. So I would watch the clock and push over 2 minutes, make sure the patient is tolerating it okay. Still assessing for any signs of infiltration, that the vein is still patent, which it is. So after that is pushed, I can discard of that, and I'm going to need to do another saline flush. So, and the saline lock is still clean because I have kept it clean while doing this. So I'm going to push this through to make sure all the medication gets through the saline lock and through the IV catheter. And then I can lock this. So I'm going to want to do a pain reassessment, but first I need to continue with my potassium chloride as well with my morphine. I'm going to keep this because I'm going to waste it with another nurse in the medication room, so I'll do that at the end. So I have my sodium chloride here and my potassium. So on the back, make sure this matches for my third medication check. Potassium chloride. Okay. So we're going to prepare the IV, and I'm going to continuously talk to my patient, letting them know what I do. I have brand new IV tubing, make sure it's within date, which it is. Okay. Open that, making sure both stay clean. I'm going to spike my bag. Okay, now that it is spiked, I can invert it and hang it on the pole. Making sure everything is closed before I begin to prime it. Okay, so I'm going to prime my tubing. I need to squeeze the drip chamber. As well, I made sure that my patient verification matched with the wristband, Shirley Coast, 4/3 of 87, as well as with my MAR. So I need to squeeze the drip chamber to about halfway. And then I'm going to prime my tubing. So I'm going to invert it, open it, wait for this part to fill, and as soon as it does, I'm going to turn it. And remove this cap, making sure to keep that clean. And I'm going to get all the air bubbles out of the line. So then we're going to want to make sure we have all the air bubbles out of the line, that the tubing is flowing. And once all the air bubbles are out, we see liquid coming out of the end, we can close it. And I'm just going to re-put on this cap to keep it clean. So, and then I would can put my cassette in here. And close it. And while I wait, I'm just going to hand this. And I can turn on my pump and begin to prepare that. So I've already flushed this, and I've done my third medication check with potassium chloride. And I have the IV ready, so I'm going to clean the saline lock. And while that is drying, I'm going to write on my IV tubing label and stick it near the drip chamber. So now that my IV, or my saline lock is dry, I can attach my IV tubing. Once that's attached, I'm going to turn on the pump. I'm going to set it to 125 milliliters, and I know this is going to run over 2 hours. It is a 250 milliliter bag. So I'm going to clean up my workstation to make sure my patient doesn't need a check on her again in 10 minutes, as well as a pain reassessment. So I'm going to do hand hygiene, change my gloves. And now it has been 2 hours, and the IV pump is beeping, and the solution is done in infusing. So I'm going to come back in, introduce myself, confirm my patient's name and date of birth, Shirley Coast, 4/3 of 87. Okay, and an allergy to codeine. Okay, so then I'm going to discontinue the IV infusion, so I'm going to stop my pump, and then I'm going to lock my saline lock, and I'm going to discontinue this, and I have my blue cap here, so that if I ever need to use this tubing again, it stays sterile. So I'm going to turn off my pump, and I've got this tubing sterile, and I'm just going to do one more flush. I'm going to clean the stopper, or the saline lock one more time. Just for good measure. And I'm going to unlock it again, and then do a saline flush to make sure all the medication is through the lock and IV catheter. So, and I've continuously assessed for any signs of infiltration, any signs of infection, or medication reaction. So now that is pushed, I can lock that. And I'm going to clean up my workstation. I'm going to perform hand hygiene and make sure my patient doesn't need anything. And once they're good, I am going to go back to my medication room, waste my morphine with another nurse. As well, I'm going to document the pain assessment, then the pain reassessment after the morphine, how much morphine I administered, that it was verified by a second nurse. The administration of the potassium chloride, what time I started, how much infused per hour, as well as what time I stopped it, the IV site assessment, and how the patient tolerated all the procedures done today.